So, good evening, everyone. At the onset, I like to thank Manoj for inviting me for DRS, and he has assigned me to talk on a topic which I believe large number of you actually have not listened till now, and we have just listened from Nandita about ultra rapid acting insulin for prandial glucose control. And if we see the journey of insulin, which started more than 100 years back, various types of insulins have come into picture. Prandial insulins for control of postprandial glucose, basal insulin. But despite whatever advances has taken place, the biggest dilemma or biggest problem with the patients is they want to avoid injections. And we often talk about patients, but when a doctor himself become a patient, he also start behaving in a similar way. So we are also not different from the patients actually. So even the doctors does not want to take insulin. When you offer them insulin, they say, "Doctor साहब कुछ कर सकते हैं क्या? Insulin को भी रहने देते हैं." So actually the quest for alternate forms of delivery for insulins are going on. Large number of them has been tried, right from buccal to nasal to lung, and this is one form through inhalation form which has been tested. And if we go into the journey of inhaled insulin, journey started way back in 1925, and it is only in 2006 the first inhaled insulin, which was developed by Pfizer, Exubra, was approved by US FDA. I still remember at the launch meeting in Delhi, we were invited, but 2 days before the launch, we received the message that the company has withdrawn this insulin and the launch in India was postponed. So this is a story of Exubra in India. So it has actually never come, although we were part of some of the trials for Exubra during that time. It's a big device. Now after that, another company in US, Mankind Corporation, developed Afrezza. Now Afrezza is a technosphere technology, which I will explain to you. And in 2014, Afrezza got approval from US FDA as a first inhaled insulin, which is a short-acting prandial insulin, right? Now, after that, it is available in US. The approved indication for Afrezza is adult patient with diabetes. It can be type 1 or type 2, adult diabetic patients. As of now, Afrezza is not approved for pediatric type 1 diabetic individuals. Trials are on. Now, in 2018, Cipla collaborated with Mankind Corporation and they got approval from DCGI in 2024, and the company is now planning to launch this inhaled insulin into our country. So therefore, probably now you are going to listen more and more lectures about inhaled insulin, what it is, how it is going to work, what are the PKPD properties. So all these information I am going to briefly discuss with you during this lecture. Now, what is Afrezza? Afrezza is technosphere insulin. So as you see the lecture, there is a short term TI. So that's why I am saying TI stands for technosphere insulin. Now this is a patented technology. In this technology, basically what they have used an excipient carrier molecule, and this carrier molecule is fumarate diketopiperazine, which is known by a short name of FDKP. Now FDKP is a carrier molecule used in other inhalational products also, including antibiotic. Azithromycin inhaled version has been developed using this technology. Now what actually FDKP is? Now this molecule usually has a negative charge, therefore it attracts positive charge particles and peptides. Apart from that, at a pH of less than 6, it forms microprecipitates. Now these microprecipitates are almost less than 1 micrometer in size. Remember, whenever you are using inhaled insulin, for the drug to reach the alveoli, the particle size should be less than 5 micrometer. If your particle size is more, majority of the drug is going to remain in the upper airways. So here, this particle size is very small, and when through breath actuated mechanism. There is a small device. This is a device. So probably the companies are going to show you. This is a very small vessel shaped device which is we are going to use with this inhaled insulin. This is breath actuated. Now when you are breathing in, the insulin will go inside and will deposit into the alveoli, and there at a physiological pH which is more than 6, this excipient get dissolved, insulin and FDKP get dissociated, and FDKPD is actually an inert molecule. After absorption, it is excreted through kidney. So it's an inert molecule which is approved by US FDA. So what is reaching into the plasma is actually only insulin. Also remember, I am going to show you that later on, that the bioavailability is roughly 30%. So not 100%. So what companies are going to market to you, it is available in 3 strengths. It is available in 3 strengths, 4, 8 and 12 unit cartridge. It is actually the bioavailable insulin. It is not that 30% out of 4 unit is going to be bioavailable. So this 4 means this is bioavailable insulin. The actual amount of insulin which is present inside this cartridge, which you are going to load into this device, is more than that. So 4, 8 and 12 is actually the bioavailable insulin, which is the marketed strength of the insulin. Now this is in brief about Technosphere technology, how this has been made, what are the different strengths available. Now the next important question, which is important to all of us as a doctor community before we use, what is the evidence? What evidence mankind has generated based on which the drug got approval from US FDA and then obviously later on by DCGI. Now these are PK/PD studies. Now PK studies has been done to find out half-life, peak action, total duration of action and pharmacodynamics to see the effect of the drug on glucose lowering effect. Now this table is important to understand for that has been created. Normally in all of us, the time to measurable insulin is roughly 10 minutes. Peak action takes place at around 40-45 minutes and by 210 minutes, insulin comes to baseline. When we talk about rapid acting insulin analog, which Nandita has talked about, time to measurable insulin is 17 to 30 minutes. Peak effects occur at around 90 to 120 minutes and the total duration of action is variable 275 to 320 minutes. In contrast, now look at inhaled insulin, which is Afrezza. The time to measurable insulin is roughly 12 minutes, which is close to physiological 10 minutes. Time to peak effect is 45 minutes and time for effect to return to baseline, although it is mentioned here as 180, but it is variable depending on the dosage of insulin you are taking. If you are taking say 20 units of inhaled insulin, this time might be little bit longer. If you are taking only 4 units, this time might be little shorter. But on an average, 180 minutes, which is roughly equivalent to 3 hours. So through inhaled insulin, we are trying to mimic a close physiological rise in postprandial insulin and its effects on postprandial glucose control. Now for that, there are 2 important pivotal studies. This is type 2 study. This has been done in 353 subjects. This study is published in Diabetes Care, where patients who were not controlled on one oral glucose lowering agent, they were randomized to receive TI, which is Technosphere insulin Afrezza, versus placebo. And this study has shown that with use of Technosphere insulin, there is 0.8% reduction in HbA1c. If you see the postprandial glucose excursion, they are dramatically reduced by using Technosphere insulin. And since the comparison is with the placebo, obviously the risk of hypoglycemia is found to be more. So therefore, the drug appeared in plasma well, has good effect on postprandial glucose, and the drug is effective. That is, the patients are developing hypoglycemic episodes also. Now moving from that, to type 1 study. All these studies are done in adult population. Now here, because in type 1 diabetes, we cannot use placebo for ethical reasons. So therefore, here the active comparator is aspart, which is a rapid acting insulin analog. Now in comparison to aspart, as you see with technosphere insulin, the decrease in HbA1c is less as compared to aspart, but when we see the risk of hypoglycemia, it is significantly lower as compared to aspart and almost identical degree of effect on gain in body weight. So both type 1 and type 2 studies have shown clinical efficacy of technosphere insulin, and based on that the drug got approval. The next important study, which is published in 2018 in Diabetes Technology and Therapeutics, is about the effect of technosphere insulin on CGM related parameter. Now this is a small study involving 60 individual type 1 diabetes. They were given CGM and they have used technosphere insulin. Again, here the comparator insulin is aspart. Now if you see time in range, it is significantly more by using technosphere insulin. When we see time above range, it is significantly less with technosphere insulin as compared to aspart insulin. And the another parameter which has been studied in this study is PPG 1 to 4 hour, which is after meal. Again, with use of Afrezza, there is significant better improvement in postprandial glucose control as compared to aspart. So this is the third important study which has been done. Now based on these studies, drug is used. Now it is probably I do not know the exact timeline, but probably in 6 months or so, the drug is going to come to India also. Now, how safe is this drug? These are the list of side effects which are observed in clinical trial with use of technosphere insulin. The most common side effect is cough. It is observed in as many as 19.7% of the patients. Now, with use of technosphere insulin, cough is going to be seen in good number of patients. But remember, this cough is seen even with other inhaled therapies also, and it is usually mild, seen when patients start inhaling the insulin, might be related to the drug product which is going to be deposited. Some of it is going to be deposited into your throat, might be related to bronchospasm or whatever the reason. But it is mild, easily manageable, not to be worried. But this is the most common side effect and also the most common reason for patients to discontinue Afrezza during clinical trial development program, which means we have to teach our patients about these side effects which is going to be observed. So if they are not going to tolerate the degree of cough which they are developing, probably they are going to discontinue the therapy. So 2.8% of the patient treated with Afrezza discontinued therapy because of cough in clinical trials. So this is a reality. This might happen in real world also. Moving from that to next is, since we are using the inhaled insulin, the drug is going to into your alveoli, and from alveoli it is going into your blood. So therefore, what is the pulmonary safety? Now for that, again the studies has been done during clinical trial, and it has been shown there is a small decline in FEV1 with use of inhaled insulin. But this decrease in FEV1 is not clinically significant. It is self-limited, and if patient is going to stop the drug, then it will come back to the normal. As you see the curve, as patients stop taking the drug, pulmonary functions comes back to the normal. But then there are some guidelines which are issued when we are going to use inhaled insulin. This is a long-term 2-year safety data, although throughout the world people have started saying, since the drug is launched in 2014 and now we are in 2025, we need a larger long-term safety data with use of Afrezza. But 2-year safety data has shown that with use up to 2 years, the change in FEV1 is static, it is not permanent, and as soon as patient stops the drug, it comes back to the normal. Now, from moving from that to special population, because we are going to see large number of type 2 diabetics or adult diabetics with large number of comorbidities. Whether we are going to use Afrezza there or not, remember there are no studies for use of Afrezza in patients with renal impairment, in patients with hepatic impairment. No study as of now in pregnancy or in lactation period, although these studies are going on and soon we are going to have results. Even in pediatric population, it still is not approved. Pediatric studies are going on. As far as geriatric population is concerned, it is found to be safe. Therefore, it can be used irrespective of the age of the patient. Now, let's go back to the basics. As I have told you, this is a device, a very small handheld device, which is actuated by your breath. The drug is available in 3 strengths, 4 units, 8 units, and 12 units. There are different colors given to these 3 different dosage: blue, green, and orange. Now, how you are going to shift? Suppose you are planning to shift a patient from injectable version to inhaled. How you are going? So there is a dosage algorithm which has been published, which is present on the net. Like if patient is taking up to 4 units of injectable short-acting insulin, you can start Afrezza 4-unit inhaled insulin. If patient is taking 5 to 8 units, give 8 units of Afrezza. So as I have shown in the slide. So this is how patient can be shifted from injectable insulin to Afrezza or inhaled insulin. Now, what are the key considerations before you start this insulin? Now, this is how the mechanism of action of this drug. Probably there is a small video at the end of this lecture by which you will know how to use this device. Now, the key important considerations are, before you start this therapy, measure FEV1 of the patients. FEV1 should be more than 70%. If somebody who is suffering from chronic pulmonary disease, bronchial asthma, ILD, FEV1 is not there, patient is smoker, then all these cases are ineligible for inhaled insulin. After you start inhaled insulin, pulmonary function test needs to be repeated at 6 months. If fall in FEV1 at 6 months is more than 20%, the drug needs to be stopped. After that, you can do it annually or you may not even do it. The small insignificant decline is not a permanent decline. It is going to revert back to the normal whenever patient is going to stop Afrezza. So friends, Afrezza is a new mode of delivery of rapid acting insulin. Only inhaled insulin approved in the world, going to come to India. It's an ultra rapid acting mealtime insulin approved for use in adult patients with diabetes. If you are going to use in adult type 1 diabetes, remember you have to use along with basal insulin. In type 2 diabetes, you can use it as a prandial insulin along with your other drugs, which will take care of the rest of the things. Based on clinical trial data, the drug is found to be safe and effective, and it has been available in West from 2014. The most common adverse effect is cough, which is manageable. You have to measure FEV1 in all the patients. It is contraindicated to be used in patients who are suffering from chronic pulmonary disease and are smokers. And currently, very recently this year, the drug got approval from DCGI, so it is going to come to India. So thank you very much, and this is probably the video. So the video is not playing, probably we'll do it.
To properly inhale Afrezza, which will look like this. I'll break the inhalation down into 4 steps and walk through each one in detail. Step 1, select the cartridge. Because Afrezza enters the bloodstream in less than a minute and starts controlling blood sugar in about 12 minutes, you'll take Afrezza right before you begin eating. Once you open one of the foil packages, you'll find 2 blister cards, perforated to tear off into small strips of 3 insulin cartridges. You'll first get your cartridge out of the strip by pushing the rounded plastic so that the cartridge breaks through the foil. Check the color and number on your foil strip or cartridges to ensure the correct dosage is selected. Step 2. Load the cartridge. After taking the inhaler out of its plastic wrapper, you'll notice that there are 2 parts of the inhaler. On the bottom, there is a short, flat, broad purple base that will let you set the inhaler flat on the table if needed. On the top, there is a thin white mouthpiece that extends out longer than the base with a purple removable mouthpiece cover. You can remember that the white part of the inhaler goes up towards the clouds. You'll want to do the purple pinch to hold the base of the inhaler level while lifting the mouthpiece up to a vertical position. This will open the inhaler. You should see or feel a cavity inside, which is where the cartridge will fit just like a puzzle piece. You'll hold the cartridge with the white cup down and place it in the inhaler so the pointed end lines up with the pointed end in the inhaler. Next, we'll close the top part of the inhaler back down. You may feel or hear a snap. That snap was the insulin cup sliding into position, becoming like a salt shaker. It's important that after this step, to not turn your inhaler upside down, shake it, put it in your pocket, or drop it, as that could lead to a loss of powder. So you'll want to do this step right before you're ready to inhale. Remember to keep the inhaler level once loaded. Step 3. Inhale Afrezza. Now it's time to inhale. Take off the purple mouthpiece cover by pulling the very thin tab towards you. Before bringing your inhaler to your mouth, exhale to get rid of the air that's already in your lungs. Then place the mouthpiece in your mouth with the inhaler tilted down towards your chin. Form a seal with your lips around the mouthpiece. Take a deep breath, approximately 3 seconds, like you would do a yoga breath or when your doctor is checking your breathing with a stethoscope. Once you've inhaled, hold your breath for a couple of seconds or as long as is comfortable, before resuming your normal breathing. Step 4. Remove the cartridge. Once you're done, open the inhaler, remove the used cartridge, and throw it away in regular household trash.
So this is the video for use of this, and what I have read on the net, because the inhaler, the device needs to be changed after 15 days. So when you are purchasing this insulin, the insulins are coming with 2 devices. I do not know about Indian marketing, at least in West, and the person has to change the device after 15 days. So this is in brief about a new mode of delivery for insulin. Thank you very much.